Hey, my name's Nick, and I'm going to take you through the hair restoration process I did over the past 5 years, so stick around. These are some of the tips and tricks that I would do or wouldn't do if I had to do the process again, and hopefully they'll help you out in your journey. If you like what you're seeing, do me a favor and click on the subscribe button down below. And let's begin. The first thing you're going to do is have a consultation with the facility of where you're going to do it, and they're going to basically look at your hair, your current existing hairline, your scalp line, your donor area, and determine if the procedure can be done. If the procedure can then be done, they're going to determine about how many grafts they can do in one procedure. Usually the average is anywhere from 2,500 to 3,000. And they'll determine how much you can transplant on the back of your head from the safe zone, which is between your ears, about a 12-inch area. That even on a 90-year-old you can look at, they still have their hair in that area. That's determined as a different DNA than the hair on the top of your head and will not fall out. They then will determine how much area they can transplant at one time and how many grafts will be required. After the consult, you'll have some time to do some prep, probably a week or two before. And about 3 days out, take some time, have somebody help you, and literally go with a marker or a makeup marker, and so that you can actually draw on your forehead where you want your new hairline. This is crucial. If you don't do this first, you'll regret it later, because this is exactly going to create the outline where they're going to do it on your head that day. Take the time, have somebody take pictures of you while you're sitting there doing it, and make sure you know exactly what you're trying to do. Maybe you have the receding hairline on the sides or your forehead you want to bring down. Whatever it is, you want to make sure that you mark it, take some pictures. Then the morning of your procedure, you will want to actually draw it on your forehead before you even go there, so that you know when you leave your house, this is what I want it to look like, and you're happy with it. You're looking at your mirror, you have time, you're not being rushed, so that you are actually able to look at it, have somebody else who's with you look at it and tell you, yes, it looks straight, or whatever you want to do. If you don't do this critical part, they're going to do whatever they draw on your head that morning when you get there, and sometimes it may not be right. Once you get to the facility that morning, the first thing they're going to do is they're going to do some pre-op procedure pictures and take pictures of before and after, basically. And this time they're also going to draw on your forehead with a grease pencil. If you didn't already do it on your forehead, that's why I recommend you do it. And they're going to draw that line. They're going to go so quick, you're not going to know what's going on. There's so many things going on that morning. They're going to hand you a mirror and go, does this look straight? And you'll look at it and be like, yeah, it looks fine. I did that. I didn't realize the first time. I should have taken a lot more time and not felt rushed by them and made sure the hairline was the way I wanted. Because if it's not, if it's crooked or it doesn't go the way you want it to do, you're going to be stuck with it. Take the time as much as you want to draw it. If they need to make adjustments, and make sure that everything is clear to them what you want. If you want more in the front or you want more on the top of your head, wherever you want it, take the time with the technician who's going to be doing the procedure for you and actually discuss this with them. And they will have a better understanding, because once the procedure begins, you're going to be incoherent. They put numbing stuff in your head and everything else. So you want to be able to have this all talked about before you begin, and so that they have a clear understanding of your expectations of the process. Then you'll go into the procedure room. The first thing they're going to do is they're going to numb the back of your head. They'll use a bunch of different numbing solutions. One of the things I highly recommend is make sure that they put numbing solution in your temples. Otherwise, you will feel it the next day, and it will be a headache that will not go away. So make sure they numb that, and then they will numb the back of your head where they're going to do the incision and remove the donor hair. That whole process takes about 5, maybe 10 minutes, and then they'll stitch you back up. Also, make sure that you talk to the doctor before he does the incision and explain to them how you want the incision to be done, because they can be very cautious if they do an over, under, and double stitch it, which will create a almost invisible scar line, which is what they do for plastic surgery. But a regular procedure where they'll just do like a baseball stitch, and they put the two skins together and then they stitch it. And that will actually show a lot more in the hair, and it'll look like you always have kind of a cut line in the back of your head. That's what they did the first time for me, and the second time I realized this and had a discussion with the different doctor who was a plastic surgeon, and they basically did 2 layers where they stitched underneath and then they folded the skin over and stitched it, so I don't have a line in the back of my head. Now that they got the donor section out of the back of your head, which will be about a 12-inch long from ear to ear and about a 1 centimeter tall, they will begin to look under a microscope, and they will separate out the grafts in 1, 2, 3, or 4 hair grafts. And then they will then begin the procedure, starting in the back of your head and working its way forward to create the most full look on the top of your head. If you can look, and they're going to put hair in the spots, even where you currently have hair, because they're going to anticipate that you're going to lose some someday, so they will always fill in the back first before coming forward. The entire process takes anywhere from 6 to 8 hours, and they're going to use a hollow needle to poke the holes. They will literally poke a hole, put a graft in, poke a hole, put a graft in. During the whole process, it's not hurting. You don't feel too much. It's a pretty simple process just sitting in the chair. One of the other things that I highly recommend you do is you wear a zip-up or button-up shirt. If you wear one that you have to pull over your head, after the procedure, you're going to have bandages on, and it will disturb the follicle. So if you have a zip-up shirt that you're able to put back on, it makes it much easier at the end of the procedure. After that, you'll go home. About the first 3 days, the number one thing that I can recommend that you do, and it's very important, is you sit upright. You sleep in a chair upright. You don't want to lay down, because all the fluid that's going to end up swelling in your head is going to stay up there versus kind of moving down your body. You're going to end up swelling up, which I didn't expect, about 3 days later, and you will become very puffy because all this fluid from where all those holes are in your head has got to go somewhere, and it will begin to drip down the front of your face, and you'll get swollen in your eyes and your cheeks. They told me, I could go back to work 3 days later. Not going to happen. If you have to be in some place that you have to be out in public, it's going to take you 7 days before you're going to go back to work. You're not going to want to go back to work because you're kind of not in pain, but you kind of feel sore every time you move. Then after that, it's kind of easy going for a couple of days. And then you will go about day 7, you can wash your hair. After you wash your hair, pretty much the following day, which I began to freak out, didn't know what to expect this, but you're going to end up peeling, and all the hair is going to fall out. You're going to have scabs coming out of the top of your head. It's going to be like your real bad sunburn. But after you wash the hair, it basically creates this process again. That's normal. So you will lose all the hair that they just put in is going to fall out. It's only falling out the hair part. The actual graft is already taken. It's in there. It's in the skin. It's doing its thing. That whole process kind of freaks you out. And then about day 13, your swelling has gone down. And come around day 14, 15, you're going to go get the stitches in the back of your head removed. They're going to make sure that the stitching everything's going good and healing okay. Take those out, and it's smooth sailing after that. Come about 30 days, you'll begin to see the little spots where the hair was going to begin to come through again. Some of the cycle of the hair is basically a different cycles, 6-week cycles. So you have 3 different cycles in your head. So basically every 3 weeks, you'll be having more hair beginning to grow. And that will happen after the first 3 months. Come by 6 months, all the hair that was going to take is taken. About 80% will take. So you will have some that's not going to take after they do the process. And by 1 year, whatever is going to grow back, it will be the full look. I did the process the second time because I wanted to make sure that it filled in more and basically created a more even look on top of my head from what I previously had done. And that's my process. Hopefully this helps you with your hair restoration journey and some of the things that I would do and wouldn't do if I had to do it again. Good luck and enjoy the journey.